Good afternoon.
Good afternoon.
Afternoon.
Thank you all for having me. I'll be talking through the data that you're used to seeing and also introducing a metrics tool today for you all to become familiar with and then that we'll begin using. And before we dive into that, I wanted to take just a few moments to go through some of the data. As you've probably seen in the news, that North Carolina is seeing an increase in new cases and test positivity is staying stable right now based on the most current governor update, which happened today. So here in Buncombe, our cumulative case count is 4,443. And since the end of September, the new cases have continued to increase. You may remember us talking that through the summer, we had the highest, we had a high number of new cases per day, around 40 to 45 new cases per day on average. And we saw that decrease to 20 to 25 through September. And then as we approached the end of September and as we started October, we've seen that new case per day average increase again to about 38 new cases per day now. We continue to see the greatest burden of confirmed cases in our 25 to 49-year-olds. That's making up about 41% of the laboratory confirmed cases. About 20% of our confirmed cases are in 65 years and older. However, that age group makes up about 89% of our COVID-related net deaths, with the largest, the overwhelming majority within that being associated with long-term care facilities. And just to blow that up a little bit for you, so if we zoom in, that's just a zoom in of what I just described, that July saw increasing cases with a decrease as we got to September, and now an increase again. Our communicable disease case investigation team continues to find that folks, as they're interacting in small groups, that the 3 W's are not being adhered, particularly social distancing. Folks aren't keeping 6 feet between themselves, just important for folks to listen and hear that we reduce our risk of transmission and exposure when we keep that distance of 6 feet or more between us. And when we add the face coverings and hand washing, often we further reduce that risk. And just want folks to remember that this includes when we are with people we may know but not in our immediate household. So when we're interacting with folks in our neighborhood and our social circles, we still need to maintain face coverings and 6 feet and hand washing to reduce our risk. And that, of course, applies when we're interacting and moving about our community. So based on our weekly testing reports, we are seeing a percent positivity of about 4%. Currently, the state is 6.6%. This percent positivity remains below 5, but has increased in the last few weeks and is consistently between that 4 and 4.5 range in the last few weeks. Our testing within the community has increased since the summer. Over the summer, we were averaging about 4,000 tests administered per week. And the 4-week average now has us at about 5,800 tests per week. And to date, the community as a whole has administered more than over 100,000 COVID tests. And then the COVID-like illness, this is that early indicator. Just a reminder that we are that bright yellow at the bottom. And you can see that Region 6, which is where we are, has seen a decrease in the percent of emergency department visits for COVID-like illness the week ending October 24th. And with that, I'd like to go ahead and introduce the metrics, a new way of looking at our data here in Buncombe County. And so these metrics align with what are commonly referred when folks talk about the White House Task Force metrics or the CDC metrics. And the color gradient allows us to see where our local metrics then fall within those more favorable to less favorable areas. And what we've done here, you'll see the actual metric over to your left, which some of them are very familiar to you, others less, but we've monitored them over time. So new cases per 100,000 population per week. Typically, we talk about the new cases per day on average, and this actually is a metric that the White House Task Force measures across jurisdictions. The percent change in the new cases, so that's just a derived indicator from 1 week to the next. Did you change in those new cases per 100,000 population per week? And then the diagnostic test result positivity rate, that's the percent positivity that we've talked about. And then the change in test positivity is just that 1 week over the other. And then the total diagnostic test resulted per 100,000. And so that is derived from the number of tests that we do weekly in our community. And then you'll see the COVID deaths per 100,000 population, and looking at it per 100,000 population just allows us to standardize those deaths so that we can compare across jurisdictions. At a local level, that isn't quite as meaningful as it is if you're looking at them for the entire state and being able to compare and contrast across jurisdictions and counties. And then percent change in deaths per 100,000 population. And the last two are in terms of hospitalizations, percent inpatient hospitalization beds occupied with COVID-19, and then the percent ICU beds occupied with COVID-19. And then those gradients off to...
I guess, yeah.
I'm sorry, is there a question?
No, go ahead. I'm sorry.
Okay.
You're good.
And then the gradients off to the right there are just based on different ranges from most favorable being clearly dark green and light green to less favorable being your red, orange, and red. And so what we've done here is put, where you see the value column, we've put our local Buncombe County data in there, current data. And so you can see that our new cases per 100,000 per week is red. It is currently 101, and so that is right there at the beginning of that red gradient. This is a decrease from last week, and so you can see that in the derived indicator just below the percent change in new cases per 100,000. That from last week to this week, we've seen a 9% decrease that puts us in that yellow area. And it's a little too early to tell if this is a true trend downward. We'd probably want to watch that for another week or so to be sure. And the percent positivity on our weekly testing report is at 4%, and you can see that puts us in that light green area. As we've mentioned before, less than 5 is what is desired. And so the light green is that 3.0 to 4.9, and then dark green would be the less than 3%. So we're light green there, and then change in test positivity, we saw just a slight decrease, which puts us also in that yellow, and percent positivity from last week to this week. And then the total diagnostic tests resulted per 100,000, we're at 2,095, which puts us squarely sort of in that dark green. And that's a result of that commitment from our community to increase access. So as I mentioned earlier, we've seen an increase in the weekly testing administered since the summer. The total, so the COVID deaths per 100,000 population per week, that is in an orange area, that's 1.9. Again, that metric is standardized so that you can compare it across jurisdictions. And then the percent change in deaths per 100,000 is at 35.7, which puts us in red. And when we talk about small data sets, and when we talk from week to week about new COVID-related deaths, I just want to make sure that folks understand that those are very small numbers and affected greatly by any aberration, plus or minus. And so I just want to use some caution there that we will likely see, because of the small data, the small numbers there, the small absolute numbers there, that data metrics could change quite a bit from week to week. It's the difference between having 2 COVID-related deaths and having 4, right? Small numbers. And then the percent inpatient hospital beds occupied by COVID and percent ICU beds occupied with COVID-19, both of those are in the green area. And you'll remember that Dr. Hathaway came the last time and joined me, that right now hospital capacity is sufficient. And so I'm going to explain this just a little bit about how we'll start using this tool, and then ask for your questions or feedback about the tool. And so when you look at the tool completely with all of the indicators or all the metrics together, what we would be using the tool for is to monitor that from week to week. You will be seeing this each time that we present to you. And if we find that 5 or more of those metrics, so at least half or more of those metrics are in orange or red as a collective, recommendations would be brought to the Board of Commissioners at that time. In addition, if we were to see 3 or more metrics in that first section of orange or red, regardless of what the rest of the group look like, recommendations would be brought to the Board of Commissioners. And also, if we were to see the 2 indicators at the section 3, which are the hospitalization pieces, if those were in orange or red, we would be bringing recommendations to the Board of Commissioners. And before I wrap up, I just wanted to show this infographic that the North Carolina Department of Health and Human Services put together as just another reminder that when we use our face coverings, have social distancing, and add our sanitizing or washing our hands, we have the lowest chance of transmission, and that anything other than that increases our risk. So with that, I'll stop and ask if you have questions or feedback.
Commissioners, any questions?
Yeah, I just got one comment. I wish we'd had the not graph, but the
Metrics?
Yeah, it's really good. Yeah, I think it's a good way. It's a good way to look at it. I mean, it's red, yellow, green is known in across the board and in measuring, and but I thought that was good. Thanks.
Thank you, sir.
And all of these metrics are measured on a per week basis?
That's correct.
Okay.
And so the metrics are, as I said, they're White House Task Force metrics, and then the hospitalization pieces are CDC metrics. So it's a hybrid of those 2, but the gradients follow the White House Task Force and CDC gradients, and they are measured weekly. So on the North Carolina dashboard, there's when you look for the filter for Buncombe County, you can actually see for new cases per 100,000. So you can see that actually daily. What we would be looking at is that week-to-week trend at a set time, so that you all were seeing the exact same thing every time.
What would be have you decided on what the set time will be? So it's from this date to this date, the same time and date every week?
Thank you. Great question. So you all are meeting at a different time this time with a Thursday. So ideally what we would be doing is the data would be pulled on Monday to look at what our trends are. So it would be a Monday to Monday, and would be ready for presentation to you all on your regular Tuesdays, 1st and 3rd. Now we'll be updating it each week, but you'll see it at these community briefings.
Okay, so every Monday there'll be sort of a new public report issued summarizing this data.
This is the report that we use for public health and for the command center.
Okay, but that'll be publicly released whether we're
When
having
we-
a meeting or not, there'll be a release of this metric for that week.
Our intent is to present it here publicly for you all and for the community at the community briefings.
Okay, right, so once a week, regardless of whether this commission's meeting, there'll be a report
No, I think the intent was just publicly here on the
Okay.
1st and the 3rd
Okay, just so every
to
other
align
week.
with our community briefings.
Okay, so just every other week.
Right.
What if, but you will check it, let me ask it this way, you will internally do this every Monday, is that correct, to kind of get a sense for what it looks like?
This is a part of our weekly command center update.
So what if we're not meeting and you run the numbers and it's like, wow, we've got 5 oranges and reds, the commission's not meeting tomorrow, but that's, our report for the week says, we're not in the right place.
If, Commissioners, if we were to get a report that had 5 or any of the metrics that we had out 3 or 2 in the other sections, we will be making sure we reach out to you if it's a special meeting, but you would be involved because at 5, we need to bring some recommendations around what we do in our community around restrictions or what does that look like. So should any of those triggers happen, we'll be reaching out to the commission.
Okay. Is there any way this could be shared with the commission weekly, whatever that Monday is, just to sort of circulate it? So we would see, even though we're not meeting the next day, here's what it looks like compared to a
Sure.
week ago. Is that possible?
Yes, I will send that out to you at the end of the day on Mondays.
Okay,
Yes, sir.
perfect. Other questions, commissioners?
Just kind of a related question is there a sense yet of kind of the complexion of the flu season this year, or any early indications of what we're seeing with that?
Thanks for that question. Really early. And so I didn't pull the influenza-like illness surveillance report, but I will say very early, and I'm not getting a lot of indication of lots of flu right now. I'll turn to Dr. M to make Dr. Mullendore to be sure, but not quite yet.
I think when I got my flu shot from the county, I think someone mentioned it there, that, or maybe it was somewhere else, I forget where I heard this from, but it was mentioned, I think, because of the way flu spreads around the world. So it starts in other parts of the flu season starts in other parts of the world sooner than here. That there's perhaps some sense that the flu season is maybe not as going to be as, maybe it won't be as bad this year as in some years. So could you just comment on that? Do we have some tea leaves from what's happening in other parts of the world to give us a sense of whether, aside from COVID, flu might be bad, typical, or, maybe not as bad?
So I think you heard that from Dr. Hathaway when he
That's
visited
right.
and presented with me the last time.
Right.
And that typically we do look at what flu looked like in the Southern Hemisphere to project what it might look like here. And I think when he was here, he mentioned that trends in that area were looking lower, but yet to be determined here, as we have just begun our flu season. And Dr. Mullendore, do you have anything to add?
And what I think, when we look at what's happened in the Southern Hemisphere and why, the thoughts about why they had a pretty easy and mild flu season is because there was a lot of uptake of the mitigation strategies for COVID, right? They had a lot of buy-in on face coverings and social distancing. And so it really is going to come down to how well we do in this country. And I'll say the numbers on COVID aren't looking so great. And so it concerns me about what that means for flu. And so I think that if we can do better with the face coverings and the social distancing, we'll have an easier flu season, and we'll also have success against COVID.
So the flu wasn't necessarily less aggressive. It's just that the things that you can do to protect yourself from COVID protect from that too, and people are working on that in a way that we don't traditionally, and that had a co-benefit.
Correct. So.
Great, thank you.
And that's a great opportunity just to remind you, if you haven't, and I'm glad you mentioned that you had gotten yours. If you haven't gotten your flu vaccine, please do. And we're recommending that folks get their flu vaccine.
Great. Commissioners, any other questions? Well, thank you for this. I will just echo, I think this is going to be a great tool for us to continue to monitor what's happening in the community and take steps if we're seeing flags go up. So thank you.
Thank you.